Hi, it's Paul. I want to look at papillary lesions of breast. So these arise in the larger ducts. They histologically have that classic papillary growth pattern of sort of coral branching growth. They are usually benign but can be malignant, and often they'll present as an atypical cyst, so a cyst with some shadowing inside it or something like that. We'll just look at one case that illustrates most of the features. These are the highest cellularity specimens that you'll see, and they have large tissue fragments, often like this. You can often see that macroscopically on the slide. And notice how this has this vessel running down through here, and you can see like a stromal core in the middle of it. Just on high power you can see it going through there. See the elongate endothelial cells that line it. And then in the background we have epithelial cells, and you'll often see them palisading in like a crowded palisade around the outside of the group. Often you can make out a bimodal pattern in those, but not always. Sometimes you'll get like this, which is like stripped cores, this collagenous vascular material that the epithelium has been stripped off, and you can see it lying in the background. Now, often that background is full of cystic debris and foam cells. You can see more vessels running through here with that collagenous blue staining. And see how it branches around the place. The epithelial cells look fairly benign, and they're reasonably cohesive in this area. Again, more vessels. So the real diagnostic essential component for reliably diagnosing papillary lesions are those fibrovascular cores to the groups. Remember, we saw large epithelial groups in the fibroadenomas, but in this case they differ by being true papillary groups having a fibrovascular core. So see how the epithelial cells are just sort of fronding off those edges. Just more cores. You can see how cellular this is, just lots of sheets. There you can see some palisading of cells along the outside. And just on high power, you can see the epithelial cells arranged around the outside of that collagenous core. You can see the vessels running through there, very fine vessels. Sometimes you'll be able to make out red blood cells lying in those vessels. And you can see it's quite complicated here. Again, vessels running all through that material. The epithelial cells looking a bit columnar down there. And a lot of them have just stripped off these cores of tissue, but you can see the anastomosing vessels running around there. Slow power again, you can see the cellularity branching of these large groups. So these have just been sheared off by the needle. Just another high power view. Again, you can see sort of some columnar shapes. And this area shows nicely the branching fibrovascular core, epithelial cells in sort of sheets arranged around it. And sometimes they form quite complex folded sheets. So in summary, papillary lesions are usually the most cellular types of specimens that you see. They frequently have a cystic background, and by nature the papillary growth needs a cystic or a space at least to grow into, so like the bladder or a cyst. It's characterized by highly cellular epithelial cells that are generally cohesive. Sometimes they form really large folded sheets as well, and often that is bimodal. you can see, or you want to see, fibrovascular cords that have collagen and vessels running through them. And often you'll see the epithelial cells attached around the edges of those branching groups and palisading with a definite columnar shape. Often these present with atypical cyst, and because we can't tell whether there's invasion present or not, it requires a detailed histologic examination of the lesion. The recommendation for these is usually excision of the lesion rather than a biopsy.